All right, welcome back. 8:13 now on your Wednesday. Well, the Manning Family Children's Hospital is offering, and they always do, a number of specialty services, including a special now brachial plexus clinic. We'll find out if I'm saying that right in a second. The brachial plexus is a nerve network that's like basically the electrical control panel for your child's arm. So Dr. Harvey Chim from the Manning's Family Children's Hospital and the brachial plexus clinic is here now to explain what these injuries are, why it could help your kid one day, and why early treatment is so important. So first of all, Dr. Chim, thank you for joining us here this morning.
Yeah, thank you so much for having me. It's really an honor to be here.
Absolutely. And let's talk first and foremost, start with the basics. Brachial plexus clinic. What is the brachial plexus and what type of specialization do you do?
So the brachial plexus is the network of nerves that runs from the spine to the upper extremity. So it's really important because if you have an injury in that area, you're not able to move your arm gets paralyzed and you have loss of sensation, loss of function. That's a big deal for most people.
Sure.
So it is a very specialized area because surgery in that area is pretty challenging. So, I think there's a desert of places that actually treat this condition.
And then you said you're the surgeon now with Manning's, and so the big deal is that this is something that is now kind of in our backyard for anyone listening, something that's available for your child. What type of injuries would cause an issue with brachial plexus?
Well, in children, it's most common after delivery. So babies get stuck coming out during a normal delivery, and this is what we call brachial plexus birth injuries. It's surprisingly common in the area around New Orleans and Louisiana. And the problem is that a lot of these patients are not diagnosed in time or present late for treatment. But if patients actually presented to clinic earlier, there are a lot of things we can do to make things better.
Does it ever happen later for a child? Or I know you said mostly during delivery. Does it ever happen in the later years at all?
Yeah, so brachial plexus injuries, there are two types. The type that occurs during delivery and the type that occurs after trauma. So in older children and in adults, traumatic brachial plexus injury is a lot more common.
And this is something where you're talking about your whole extremity, your whole arm goes completely numb, just you can't use it anymore.
Yeah, it's not just the numbness, it's also the weakness. So they're not able to use, depending on the extent of the injury, they're not able to move their hand, they're not able to move their elbow. So it's very disabling for people.
Yeah, I mean, I'm assuming it's hard to pick things up, obviously.
Oh, you're not able to use your arm, so it's a really difficult issue for people.
And so you being now at Manning's offers a lot of benefits for anyone who has to deal with something like that. Talk about sort of the benefits of having this clinic here so close to home with Manning's at the Children's Hospital, because you were saying that in the past you would have had to have traveled a little ways to handle something like this.
Yeah, absolutely. So I think in brachial plexus reconstruction, timing is the key. So we can offer the most treatment options when patients present early, within about 6 months of the injury. So we're not able to do many specialized types of nerve surgery more than 6 months after the injury. So it's really important that patients present early. And like I mentioned, this is really a specialized field. So we attract patients from all over the Gulf South, from Louisiana, from Alabama, and there really is nobody in between Texas and probably Atlanta or Alabama, Birmingham, that actually treats this sort of injuries.
Except for you now.
Yep, exactly.
Exactly. Yes. Well, we're happy to have you, obviously, and this is something that I think parents are always looking for new ways to learn about certain injuries, because kids don't always tell you, or can't sometimes at all tell you when something is wrong. So Dr. Harvey Chim with Manning's, we appreciate you coming on with us this morning.
Yeah, thank you so much for having me.